Hello, and welcome to Forget What You Learned, a place for families to stop and reflect on the modern state of education. We empower you to challenge your own thinking about today's traditional school system and ask the question, are my kids thriving? I'm Cory Greenberg, a parent in the trenches just like you, and I chat with innovators, experts, and other parents who are changing the conversation, inspiring families to reevaluate how we define academic success. This podcast is brought to you by Pacific Preparatory, who is molding education through innovative one-on-one learning for students in today's digital world. When your child is struggling in school, it can feel like a mystery you're scrambling to solve. Should you get them tested? What kind of test? And will it actually lead to support or just more questions? Today, I'm joined by Jana Parker, a licensed educational psychologist and neuropsychologist who's spent her career helping families decode learning challenges and take action. We'll explore what different kinds of testing really tell you, why the school route and the private route lead to different answers, and how to avoid the all too common trap of chasing a quick diagnosis that misses the full picture. If you've ever felt lost in the testing maze, this one's for you. Hello, and welcome to the show. Today, we're diving into a topic that so many parents eventually confront when their child is struggling in school: educational testing. What kind of evaluation does my child need? Should I go through the school or seek out a private assessment? And once I have the results, then what? To help us break it all down, I'm joined by Jana Parker, a licensed educational psychologist and board-certified school neuropsychologist. Jana has spent decades helping families make sense of their child's learning profile, whether they're dealing with ADHD, other learning differences, anxiety, or simply the mystery of why a bright student is struggling in school. She brings a rare dual perspective, having worked both inside public school systems as a school psychologist and a special education administrator, and now in private practice through her clinic, Mind by Design. Jana doesn't just hand over a testing report. She partners with families to interpret results, advocate for their children, and build a roadmap for real support. In this conversation today, we'll unpack the differences between psychoeducational and neuropsychological evaluations, what to expect from a school district versus a private provider, and why the path to getting help isn't always as simple as checking a few boxes at your pediatrician's office. More broadly, we'll reflect on where testing fits into the bigger picture of education, equity, and what it means to support the whole child. Let's get into it. Welcome to the show, Jana.
Thank you so much.
Okay, I think we should start with just laying the stage for people to get oriented to the terminology, because I myself, having 3 kids and being in the world of education, I still was kind of confused about the difference in the names of the different testing processes. So let's start with that. Can you just tell us, like, what are I said psychological, I said neuropsychological. What is the difference between the different evaluations?
And psychoeducational.
Yes. All of them.
Yeah. And I almost want to say that as time goes on, there become, just more words to describe what it is that different people do. I think it's pretty objective, but maybe there's a little bit of subjectivity to it as well. I think that the what I think ultimately what parents want to know is, what am I going to get out of this evaluation? And what kind of professional is administering this evaluation, because that will potentially impact what you get on the other side. And I think so first the questions are, what do I want to know? And then what do I ultimately want from this? And so if questions are really around, let's say, just kind of mental health, and that would be more of a psychological evaluation. If people want to know how is what's going on in terms of cognition and processing of information, maybe attention. How is that related to how my student is functioning educationally? That's a psychoeducational evaluation. If someone wants to know what's going on, maybe psychologically and neurologically, it's more of a neuropsychological assessment. However, there are neuropsychology and neuropsychological assessment can be done by all different kinds of professionals. It's just like what their training is and how they're. I always say kind of like how is the professional looking at the processes that are going on, and a neuropsychological evaluation to me means it's a brain based evaluation. So we're really trying to understand what, like, brain behavioral evaluation, what's going on in the brain, how is that related to the behavior or what we actually see. And people who, like neuropsychologists, doctoral level, and medical doctors, who are neuropsychologists, look at something in a very intricate brain based kind of way. As a school neuropsychologist, I have extensive training in looking at how the process, like how the different functions of brain processing are related to the outcomes that we see educationally. And that may be socially, it may be emotionally, it may be academically, right? But all kind of related to how that plays out in the student's profile through assessment and then through what we actually see in their behavior and how they're doing at school. So, different kinds of people and professionals may administer different kinds of assessments, and it's not clear cut because I will say in my practice that any evaluation I do has a neuropsychological bend to it because I've been trained that way. And I train all of my staff that way, whether or not they've had extra training themselves outside of my clinic. I'm training them to think and evaluate in that kind of way because that's really what's important. We want to know what's going on so we know what to do about it. We're not just looking at maybe the surface level discrepancies between maybe what cognitive potential says and academic achievement, which is kind of like a kind of an old way of looking at um, assessment in general. This is a very long winded and probably confusing way of saying that I guess it doesn't, what matters most is what parents want to know about their kids. And when they reach out to a professional, first of all, they would just want to make sure that someone is licensed to do it, and whether it's a licensed educational psychologist or a licensed clinical psychologist, right, or just a licensed psychologist, the person has to be have a license to do that work, and and then they want to ask the questions that they have and make sure that the person who is doing that evaluation is going to, that they feel like they're going to get the results that they're looking for out of that. And sometimes they don't even necessarily know. They just think something's going on and I'm not sure what it is. And so then it's like choosing someone who's going to, number one, like, just feel, you want the family wants to feel good about who they're going to work with, and ultimately what's going to happen on the other side of that. And the training that the professionals have will also guide, um, like, how connected they are to the outcomes. Some will just give, here are the recommendations, good luck, you
Figure it
know,
out. Yeah.
yep, figure it
Yeah.
out. And others will be like, here are the things I want you to do. Let's connect you to the resources, or let's have follow up meetings. We can help you with that here. There's a lot of different things that come on the other side of the evaluation, and it depends on what kind of training and just kind of the scope of the work that different professionals are doing, which I know can be confusing, and that's why.
Well, I think actually what might be helpful is to then go to this question is if the school recognizes that there's an issue and lets the parent know, or the parent is reaching out to the school saying, my child's struggling with the homework, or they seem to not be understanding the math, those kinds of things. If a parent's first stop is to the school, they might do what? Like, what do the schools tip, and it may be different a public versus a private school, because, if you're in a public school, you have certain rights to request testing and things like that. So,
Yep.
let's maybe go to that. Is what would the school typically recommend in terms of very practical, okay, your child needs an evaluation, so we as a school know how to help them, or if the school is not the right fit, for
Yep.
example.
Yeah, it's going to be different in public and private school. So in public school, if the school, because usually schools are tracking data, right? Usually
Mhm.
schools are doing screeners or benchmark testing, and they don't want students to fall behind. So the school will flag and support kids if they have interventions to do to support whatever it is that they're seeing if a student might be falling behind. Sometimes, they will always, well, I wouldn't say always, but they like to bring the family along in that process. Usually, a family knows that their student is in intervention services. And then if they get to a point where there's still questions or progress is not being made at the rate that they would expect given the intervention, then the school might recommend we should do an assessment, right? But on the parent side of that, if a parent is concerned, they can always ask the school to do an assessment. And at that time, the school team usually comes together with the family and says, okay, well, what's going on? What are you concerned about? What are we doing about that? Should we continue to try to support that and see if that improves uh, with some intervention, or are we going to just jump right to an assessment? Um, there are reasons why jumping to an assessment may be a good idea and may not be a good idea. There are reasons why you may want testing for special, because the school's testing is for whether or not students would be eligible for special education services. So it's really the questions that that a school district is trying to answer really is, do they meet these requirements for special education? Do they meet the criteria? And if so, how are we going to support them? Um, Alternatively, a private evaluation is going to provide diagnoses, try to figure out what the questions are that a family has, answer those questions, and then figure out what to do about it. So it's pretty different, It's
Yeah.
like educational versus clinical. But at a private school, what a private school might do is same kind of thing to bring a family along to do intervention if they have it. Some private schools do, some don't. But if a private school is suggesting that a student go through an evaluation, it's usually because they are noticing that something is that the student is not learning at like either the rate of progress or like their social skills or their attention, or something is different. And either, and usually like they want to kind of put a name to it because uh a diagnosis, number one, like kind of opens doors for accommodations and other supports, but number two, it helps people understand what's going on because there are evidence based supports and strategies and interventions to help. And that's why they have a name, right? Because there's been
Yeah.
so much research on them that evidence based interventions exist to support students like that. So, but the private schools don't usually do the assessments themselves. They usually refer out to professionals in the field, in the community, to for that, so usually that's up to the parents. Now, a family in a private school can also go to their school district and ask them to do an evaluation, which is a lot more cost effective because it's paid for by the school, so it's free to the public. But when families do that, they just have to know, what your that kind of assessment is geared toward whether or not a student is eligible for special education, not
Right.
and not necessarily answering all the questions the family has and not ever giving a clinical diagnosis.
Right, right. I think that's a very important distinction that is confusing.
Yeah.
It's like you can go to the school district, but like you said, we should say that again. You're not getting a clinical diagnosis. They're not going to say your child has autism or your child has ADHD. they're simply going to say, like, these are the supports that your student is eligible for, basically based on the symptoms, right? Is that a good
Yeah,
way to put it?
it would say there are 13 eligibility categories, and there are different criteria for each one. So they would go through the different criteria and say, they have these characteristics, so they meet this educational criteria for autism, or educational criteria for specific learning disability, like dyslexia, right? But
Right.
they won't give a clinical diagnosis, which is sometimes okay, but
Mhm.
what happens is, they'll say, even so, there's a lot of students who kind of fall in this gray area at schools between, like, they're not keeping up, but they're not falling enough behind.
Yeah.
So they're like, there's something going on, and that something may be a clinical diagnosis, right? It may have a clinical name, because the criteria are different. So a person in clinical practice may say, this is called dyslexia and it needs this kind of support. And a school district might say, well, we see that, but it's not bad enough. So we're not offering support, nor can we tell you to go out in the community and get some tutoring or get some structured literacy intervention. We can't tell you to go out in the community and do anything, because we are obligated to only be able to talk about what we can provide. And if we can't provide it, then you're going to have to go figure it out on your own.
Yes.
And it's
Okay.
just because they're not allowed. Like, it's not because they don't
Right.
want to. It's just
Right.
because if they say, "Well, your student really might benefit," even though it's not bad enough for special education, which is a good thing, right? Like,
Mhm.
you don't want it to be bad enough for special education if you can help it, right? That's
Yeah.
a horrible way of saying it, but that's I'm just being very transparent. If the weakness isn't weak enough, then, they could still benefit from some intervention. And someone like me in private practice might say, I really think you should go get some structured literacy support. But the school's never going to say that.
Yep. Yep. I think that's just that piece is really important for people to understand the difference. And, like you said at the beginning, it helps families sort of pick a path that, like what do they want to find out and what can they do with the information. So
Yeah.
that leads me to the other issue or question for you is pediatricians. And so I know, I mean, I see this all the time. Families going to their pediatrician with, my kid, everybody knows about ADHD now. Everybody knows, what the common symptoms are. And when it starts popping up, behavior at home, usually school, we're seeing some things. And so a common thing that folks do is go to their pediatrician. And I think you fill out a few forms. The teachers might fill out a form. And then the pediatrician says, yep, you qualify, you're diagnosed with ADHD. Would you like to start on a stimulant? So can you just unpack when that might be appropriate, what may be the risks and the benefits of having your pediatrician diagnose and then monitor medication
Yeah,
that way?
absolutely. Like, if a parent is like, oh my God, my student is, I can just totally tell, there's something going on. I think it's ADHD. There are all these symptoms that are so obvious, and I think they might need medicine. That is like the easiest way one to just be like, okay, you know what? Go to the doctor, have them do an interview with you, have them do some rating scales, check the boxes. Yes, we see these symptoms. It is impacting their life. They have ADHD. Let's start a stimulant. And when we get calls like that, I mean, it is the most cost effective and the fastest way to get that kind of support. But we have other times, I mean, first of all, a lot of parents don't want to go the medicine route if they can
Yeah.
help it, right? I mean, it's not the most popular thing that parents are usually saying. They're usually like, oh, I think there might
Mhm.
be some ADHD. I'm seeing these symptoms. we're not sure what to do. We want to make sure that this is what it is. And we also kind of want to understand what my kid's specific profile looks like and what we can do about it. And maybe we'll do some medicine at some point, but maybe not. And like, what else could we potentially do? Or is it bad enough, right, to need medicine? And so we will actually have a lot of pediatricians refer to us or just like to other clinics in the community who will do a more comprehensive uh, evaluation of the same symptoms, right? But taking a longer period of time, right? More hours of a person really digging into it and trying to understand the particular student because one person with ADHD is only one person with ADHD, and also ruling out other things
Mhm.
because especially kids come with all different things. Well, they're not really doing very well with reading, and I don't think they have an attention problem, but I don't know, right? Like maybe they do. It doesn't seem like they have an attention problem, but like we do, people who do these bigger kinds of evaluations are really trying to dig deeper and understand what's going on so that we have more to suggest for how to help, right? Instead of just giving like a blanket, here are all the recommendations I give when people have ADHD, we individualize it.
Yeah.
What might work for this student based on what we've learned because we've taken a deep dive to understand that. What are the breakdowns in the attention and the executive skills that we're seeing in this particular student? And so, what will we recommend to try to support that, whether it be medicine or and other things, right? And so, the medicine part is tricky for parents to navigate, and so a lot of times a more comprehensive look at it helps parents either feel more comfortable, just help them feel more informed, so that they can make a more informed decision as to what they want to do. And and then, so a lot of pediatricians refer to us. We'll do a more comprehensive look. We'll bring it back to them, because they don't have the time that it takes to really, and they don't want to overprescribe.
Right.
I'm assuming, but like they don't want to overprescribe. So they appreciate someone taking a deeper dive, and they just don't have the bandwidth to usually go that deep and that extensive and really find out more information that's going to help us navigate that.
Um, when you think of a layperson, so a parent who doesn't have training in, ADHD or other learning differences or brain, challenges, what are some of the common other sort of diagnoses that could look like ADHD or could be blended with ADHD that it seems pretty straightforward if you like read the symptoms, but there actually could be other things going on.
Yeah, I mean, it doesn't even have to be another disorder. It could just be
Mhm.
like they've had too much screen time or they
Oops.
like they haven't learned coping strategies to deal with they haven't learned these executive skills because they've been doing something else, or they're not getting enough sleep, or they have some kind of vitamin deficiency, or they have anxiety, or they have a learning disability. There are lots of, and I don't even want to say that like we always know for sure when we do an
Mhm.
evaluation, right? I mean, because we're still on the outside taking all of the information that we're gathering and putting it together to um, formulate what we're seeing, and really looking at those different characteristics. But like you said, the characteristics are pretty straightforward. The um the question really becomes, how impactful is this? Because everybody has also like a lot of those symptoms in some way
Mhm.
or form or another, but it's when it becomes problematic in somebody's life and you have enough of the symptoms in one or both categories of ADHD to really earn the diagnosis, right? It's like kind of like, how impactful is it? And so it gets difficult sometimes, if parents are saying like, well, I really don't see any of this at home, and teachers are like, whoa, we see so much of this at school. Then we're trying to understand, well, like, what is this? Like, did it show up before age 12? You know, do you have 6 of 9 symptoms? Is it to the extent that it's really causing some functional impairment in your life? Or are you also just on technology all the time after school? And so you're not doing your homework, or
Mhm.
like having difficulty self regulating because when we pull you off of the iPad, you have a meltdown. Is that ADHD or is that, dopamine rush and withdrawal?
Yeah. Yeah. Yes, and I mean, I've heard just different case studies about specifically, anxiety, OCD, other, like nonverbal learning disorder. I've heard a little bit about like some of those, can look like ADHD, like you said, but breaking down how many symptoms do you actually have, where are you seeing it, seems to me like necessary to have someone like you or, just an evaluation, like really kind of trying to dig deeper because the treatment of it or the addressing of it will look very different depending on what it actually is or what the root cause is.
Yep, yep,
Yeah.
exactly. And even again, like even if we're not 100% sure, right? I mean, because when we do an evaluation, you have a certain amount of time to get as much information as you can. And sometimes it's very, very clear, and sometimes it's a bit unclear still, right?
Mhm.
But that still gives you so much, we still have so much more information. Because, like, sometimes we'll come up with like a diagnosis that's like, well, we're going to use this kind of as a working diagnosis, but we still are not totally sure. But at least because we've done such a deep dive, we understand so much more about where we want to target intervention and how,
Mhm.
rather than just being like, oh, let me check off these symptoms on a rating scale online that, someone has developed. And, oh, yep, I have ADHD. I'm going to go to the doctor because I think I have all
Right.
these things.
Right.
That's why it's also, it's kind of scary how much is out there, like just for people to read and get, just because there is something to people who have been clinically trained to really
Yeah.
evaluate these different things. Uh, and it's important to make sure that someone qualified is looking at it, not just Chat GPT.
Well, and that I mean that really brings up the idea or the topic about labels and like when they are helpful and when they could be harmful and how often we you need to relook at it. So like your example of, maybe we're using this as a working diagnosis. When is it appropriate to kind of go back and look at it again,
Yeah.
you know?
It's such a good question. And there are two reasons for diagnosing. Number one is for insurance. Number two is to inform intervention. And ethically, less is more. Interestingly, when you go to see a therapist or a psychologist and you're just kind of like going to therapy, a therapist is going to have a working diagnosis because that is what they're putting on your super bill, or
Mhm.
that's how you're getting reimbursed for insurance. And the problem, so what they don't do is write it down on a piece of paper on an evaluation report, right? So it feels like a little more like a working diagnosis. We're working, right now we're working on their anxiety. Oh, now it's really seeming more like I'm treating OCD symptoms. Oh, now I'm treating more depressive symptoms, right? It's not it's natural for them to go through changes with that. When you come to do an evaluation, we're actually like at the end, like writing down on paper, this is
Yeah.
what this is. And I I always think, and how I train my staff is less is more. We want to be um really cognizant and careful about what we put down on paper because we don't want it to be limiting, like a limiting
Mhm.
factor or a limiting belief about somebody, like this is what I have. And so, and then we also, on the other side of that, sometimes parents are like, no, I want all the diagnoses, because I'm trying to get something, like I'm trying to get
Okay.
accommodations or,
Right, right.
right. So it's a tricky place to be. I think that a diagnosis can be empowering and validating for people.
Mhm,
I
mhm,
also think that they can be limiting if they are not fully understood and in a way that can be helpful. So, to answer your question about like when do you go back and revisit, we write that down. We
mm,
kind of write it in the report so that if someone is going back to this document and seeing like, well, they called it right now other specified attention deficit hyperactivity disorder because there are um, some, but they have insufficient amount of symptoms to give a full diagnosis. So maybe we're looking at 3 or 4 out of 6 that are required. And then we could say, so we're giving this other category because they don't have all of the symptoms. But in the future, if the symptom count becomes higher, then they might meet criteria for a full diagnosis, right? Um, it o- or if they have some symptoms of anxiety, do we want to say this is like an unspecified anxiety and we want to do more evaluation in the future? Are we going to say it's other specified anxiety because they have some but not all of the symptoms? Or are we going to say it's generalized anxiety disorder? Either way, like what we're really trying to do is say like I want to mention that this is something that should be either monitored or treated.
mhm.
And then people should be revisiting as um, as time goes on. So one of the hardest parts of doing these evaluations is that we don't we're not connected to the family anymore unless we make an effort to continue to connect with them or unless we set up this our system so that they have natural touch points to come back. Like when you go to a doctor and a doctor's prescribing medicine, they say, okay, I'll see you in 3 months. And it's like no big deal. But
Right.
if we say, okay, I'll see you in 3 months, sometimes parents are like, what? I thought this was over. I didn't know I had to come again. But we
Yeah.
love to see parents in 3 months, right? Because, okay,
Yeah.
what is happening now? Did you go and do the thing? Which are the things that we chose for you to go and do? Did you do those? Is it working? Right? Because kids are always changing, right?
Yeah.
And their situations are changing, their teachers change, their supports might change, their sports change. And so you might cut their friendship groups change. So some psychologists will continue to see a family through, and others will just kind of be like, okay, if you need another evaluation in the future, come back and see
Yeah.
us
Like
or go somewhere.
this was a snapshot. We gave you the picture and do with it what you will. Um are there certain diagnoses that are for life? Like once you have been diagnosed with it, you have that for life, whereas others can shift and change and maybe I don't know if the word is grow out of them or, they can sort of be managed enough that you don't meet criteria anymore?
Yeah. I mean, I
Okay.
think that, aside from, well, I'm not going to speak like completely intelligently on that question. I guess like this isn't backed by research,
Okay.
I guess is what I'm
That's
saying.
fair. It's fair
Right.
disclaimer.
But I would say that people change, right? So there are some things that are kind of lifelong, like, autism, depending on how significant it is, you may see um, some impact of autism for life. You
Mhm.
know, you may also see some tremendous relief or uh, different kind of functioning throughout life for another person with autism, right?
Yeah.
A person with an intellectual disability is likely always going to have an intellectual disability.
Mhm.
However, the the um, kind of prognosis for that person is really based on so many other things, right? I
Right.
mean, there's so much that can happen with every person. So I think that there are some that are like more static, but I think a lot of them are more fluid.
Okay.
And
Yep.
I think it's really about um, being able to provide the support for people, and them also they have to engage and take advantage of it, right? Like
Hmm.
they have to do it, right? I always say the evaluation is just the first step. It's what you do with the information in that moment and beyond that
Yeah.
is going to move the needle, however it is that um, that the person is trying to do, or whatever you're trying to like get relief from or grow from. Or But I really think that a lot of it is fluid.
It's so interesting, like in context with what you said about your identity and like how a diagnosis can shape or impact your self identity. And like, if let's just take autism because I have heard and anecdotally that we're seeing an increase in later life diagnoses of autism and people adults like seeking testing now. You may be seeing that in your practice. That people are saying, I think I've always had this. Can you tell me for sure? And how that really impacts like maybe that sense of relief or empowerment of, okay, this kind of explains what I've always experienced. But then, like, if you get an early diagnosis and it really gets rooted into your sense of self, but then things shift and change, like how that may impact a growing, a
Yeah,
teenager and all of that. It's pretty deep. I don't know. That's making me think.
absolutely.
Yeah.
Yeah. And I think it can be empowering at all ages. And it can also be not empowering. It
Yeah.
can,
Limiting, really
right,
limiting.
limiting.
Yeah.
And I really think it depends on the way in which it's framed for the individual student, kid,
Hmm.
person, the way it's framed, the way they're supported by others,
Hmm.
um, the kinds of interventions that and strategies that are used to support them. There's a whole movement around neurodiversity affirming practices, right?
Yeah.
And learning how to, I think it's like the people who are supporting others in helping to frame it in a way that is more empowering and kind of like an individualized perspective of like, this is who I am. This is how I identify it as myself. These are the kinds of things that I struggle with. These are the kinds of things that I'm excellent at. And this is what I want for my life. Right. Just there's so much that we can uh, do. Uh, to support, but it's like a kind of I think about the people who are supporting others. It's a lot about that and how it's framed for
Yeah.
the student.
Yeah, for sure. And yeah, I just think and it can be I'm sure a very emotional process for the family to depending on the outcome and then also sometimes for them to find out or be confronted with the fact that the school that the child is in is not going to be the best fit for them,
Hmm. Yeah,
and I know you at your practice do a wonderful job of sort of guiding the families and trying to help them figure out next steps in terms of intervention and other schools that might be a better fit. We at Pacific Preparatory, we see a lot of students where that's why they come to us because they've determined from, this assessment process that a one-to-one model might be the best fit for them. But not just us, there may be others, smaller schools or just different setups that might work better.
absolutely. Yeah.
Yeah.
We have that conversation a lot
Hmm.
about, whether it's public and we think they should go, maybe they need to go private, or it's private and they need to go specialized, or it's specialized and they need to go one on one. We really try to give the recommendation for what is going to be the most advantageous and effective for the student that we're working with,
Yeah.
because we know how short of a time kids have in school or
Yeah.
in the school age years, and we're trying to maximize the learning and growth,
Yeah.
and sometimes that means they need something different.
Yeah. Well, they're lucky to have you kind of walking them through that. And I think that parents, when they are going to a private evaluator, they should really ask that question: is like, what am I going to get at the end of this? Like, and because I've seen evaluations that are very in like not legalese, what's the term? Like, just kind of jargon that is
Yes.
hard to understand versus, no, I'm going to get a layman's report so that I, as a parent, can understand this and really specific tailored recommendations for what to do. Now, like I said in the introduction, a roadmap for them.
Right.
Um,
It's
yeah,
such a good point because we work on that, tirelessly. Like, how are we presenting what we're doing? Because no matter how jargony the report is, we've all given the same tests. Like,
right.
everybody's given the same assessment tools. It's how are we using those assessment tools to understand what is this really telling us about this student, and how are we going to communicate this so that people really understand it and know what to do about it. And so, yeah, we again, sometimes less is more.
Hmm.
And I think ultimately it's about understanding, like being able to use the information that you now have. I was thinking about something we were talking about earlier with just like public school assessments. I think that one of the things that is important or I think it can be helpful for a family to really understand that if they're going to go to the school for an assessment, this is what they're going to get, right? And it can, because parents get upset at the school for not answering their questions
Right.
or not offering services or not giving recommendations. And then those families end up coming to us to get an independent evaluation that the school
Hmm.
pays for,
Hmm.
as a second opinion. But if I having worked so long in private practice, what I really try to do with all families that we work with who are in public school is share the realities of what public school assessments are all about, so that the expectation is not that they're going to get something different, because there doesn't have to be this battle, right?
Right.
It's just, this is what this is, and that's what you're going to get if you go there, right?
Yeah. Yeah. Yeah, I think you're absolutely right. As long as the information is shared ahead of time, then they can set their expectations, and knowing that they may end up seeking an outside evaluation to get a fuller picture.
Yeah, yeah.
Yeah,
And
yeah,
I think it saves the relationship, because really the school staff usually want the kids to be successful, right?
yeah,
Like, they work
yeah.
in schools because they want to help kids and they want to teach kids. And so the people who do the evaluation are often uh doing a good job of what it is that they're doing in the scope of that work. And it's just a mismatch between what that education is about and what parents might expect.
Yes, of the expectations.
Yeah.
Yeah,
Yeah.
that's a great point. Okay. Well, Jana, this has been lovely. I knew it was going to be. I think this is like probably the most information packed episode that we have this season. So I'm really excited about that because I think it's very practical for people that are just trying to understand what they need.
Yeah.
So let's do the forget this, try that segment. So I would love for you to tell me just one outdated, it could be probably educational given your background, educational practice or belief that you think people should forget and what we should replace it with.
I didn't prepare for this.
I tried to give you the warning so
I
you're not on the
know.
spot. Here you are on
I'm
the spot.
sorry. Okay. Um all right. I think that uh people should forget that dyslexia is about reversing letters.
Oh, okay. Mhm.
And instead they should understand that it is really about a phonological issue. It's an issue with sounds and how sounds connect to letters, that
Mhm.
connection between the sound and the visual representation of the letter, and then remembering those letters and groups of letters, and ultimately remembering what words look like. But it is not a visual processing problem, and it is not a BD reversal problem. It is really a sound and then sound symbol relationship. Um,
Does that misconception come from the idea that that may be the first symptom that someone might see of dyslexia?
I'm not even sure because
Okay.
I mean, reversals are common among
Mhm.
people, but I think it's just historically, this is totally, again, anecdotal, this is not
Mhm.
evidence based, but um, you hear people like from our generation say things like that,
Yeah.
like, oh, well, I used to see words backwards. Dyslexia is not about seeing words backwards. It may be about not understanding, not being able to connect the letters, the sounds to the letters that you see easily. But when we're trying to really remember what it was like when we were learning to read, we can't, right? Because
Yeah.
we can't do that. So maybe people remember it as that, and maybe we were initially taught that that's what dyslexia meant, but it's not.
Okay.
It's not what it means. And
Okay.
yeah,
Thank goodness we have advanced in all of these areas in the past 30 years
yeah, because
and
it
understand.
informs instruction. It
Yeah.
informs intervention. It informs instruction. We're not teaching kids how to like recognize what letters backward, whatever.
Yeah.
It's
Yeah.
really a different kinds of interventions that kids need for word reading.
Okay. Wonderful. Thank you for that. Even on the spot, that was a great answer. I appreciate it.
Thanks.
Okay, and then lastly, before we close out the show, where can people find you? There now you're going to have people flying in from all over the country to get an evaluation done by Jana Parker. I'm just kidding, but maybe I don't know.
Maybe.
But yeah, where can people find you?
So we're in Campbell, California, which is in the Silicon Valley, like San Jose area. And we have a little clinic here that I'm very proud of. And I have right now 5 of us educational psychologists on staff, and I'm bringing another one on. And we're just like a great group that have all been school psychologists. And we're taking the knowledge that we know from working in schools and using it uh, in our clinic to help really bridge that gap for mostly kids who are in private school is who we do evaluations for. We do some public school and some IEEs, but it's really helping because the private schools don't have a school psychologist, but we understand what it's like to work in a school system and to we understand the importance of what the educators are seeing, and we really try to make our evaluations useful for educators to use and partner really closely with private schools and educators so that we can help them, right? And that's not just like, here's the report, good luck, but really, how do we help you help your students? And so we're in Campbell. The website is themindbydesign.com. Okay, themindbydesign.com. I can be emailed at jana@themindbydesign.com. And we do consultations with families too, just like when parents have questions about what it is they're dealing with the school system. We don't do advocacy, but we do like a ground level. Let's help you understand what might be happening here. Maybe you've had some meetings at your school, you're not quite sure what to do. And our goal in those meetings is to just help lessen the anxiety and give you some practical steps of things you can do to work within your school team. Maybe we say, this is a great opportunity for you to go get some intervention, or maybe it's time for an evaluation. But evaluation is often not the first step. Often the first step is do some intervention. If you know what the problem is, like if you know you can see a problem, you don't necessarily need an assessment in order to try to help that problem, right?
Yeah.
It's
Yeah.
so you can't even actually diagnose a learning disability until someone has had 6 months of intervention. That's like part of the diagnostic criteria. So, yeah,
That's really good to know. I did not know that.
yeah,
Okay, that's great. And do you do those consultations virtually?
we
Can
can, yeah,
anyone?
anybody
Okay.
can, yeah. So we can do
Okay.
that virtually. Um, our licensed clinicians are actually like uh, our clients have to be in California. So you can be
Okay.
anywhere in California, but I do have someone on staff who's a teacher who
Mhm.
also is very familiar with the IEP process, and she can chat with people outside of California.
All over
It's
the
just our
place. Okay.
license. Our
Yep.
license makes us stay in California. But
Okay.
yeah, we love those. We love just talking to families um, about what's going on. I feel like it should be part of like a benefit package for corporations, like
Yeah.
as part of what is it called? Something something. Like
Oh, the EAP
yeah,
process.
like an
Yeah.
EAP.
Yeah.
Because you think when a parent goes like, "Oh my gosh, we just had November uh reporting period and we just had conferences and they say my child is struggling." Like immediately you're you are not as effective at work. You are
Right.
anxious, you're thinking
Right.
about your kid and you don't know what to do and you don't know where to go, who to turn to, who to talk to, how do you get to the people who know, right? So we love doing those kinds of meetings because we just go, okay, tell us what's going on. Let us help you like figure out the best next steps. And it's like an hour, wham bam, and you're on
Yeah.
your way. And then you can like breathe and go back to work. And
Yeah, perfect. Okay, well, that's your next marketing goal is to market to all these big corporations to include you in their EAPs.
I know I've thought about it. Maybe somebody listening will be like, ooh,
Yeah,
I'm gonna do
I'll
that.
call you.
Yeah.
Wonderful. Well, Jana, thank you so much for coming on the show today and enlightening our audience. It's been an absolute pleasure. We love referring our families to you that are in the area and need evaluation. So just happy to work with you. And you're a true expert. Thank you
Thank
so much.
you. Yeah, you're so welcome. Oh, I will say, just as another thing, I do virtual workshops and stuff like for
Oh,
families.
great.
Yeah. So if anybody listening like wants any of that, just feel free to reach out. I love like teaching.
All right. Hit
Yeah.
Jana up, everybody.
Yeah. Hit me
All
up.
right. Thanks for joining us today. Take care, everyone. We hope you enjoyed this episode of Forget What You Learned, hosted by me, Cory Greenberg. As always, our goal is to allow you to zoom out on the snapshot of your family's life and answer the question, are my kids thriving? We're here to inspire you to make those small and maybe big changes to answer yes. We'd like to thank our sponsor, Pacific Preparatory, an organization committed to educating students with an innovative and holistic approach in today's digital world. Don't forget to subscribe to the show and leave a rating and review. See you next time.